Why should we worry when public health leaders spread bad science? And what addiction history means. I want to be clear up front. Addiction is a disease and recovery deserves respect. But Robert F. Kennedy Jr. has publicly said he was addicted to heroin for many years, including through his college years, and that he's in recovery, and that's on the record. But two separate questions are worth asking out loud. First, when someone now in a position of influence makes repeated claims that contradict mainstream science about vaccines, autism, psych meds, now he's saying that medical school doesn't teach the root of the problem or finding the root of the problems, and he's just gone off, as you know, with the CDC. And we should call out these claims with facts. Second, long-term opioid addiction can change the brain circuits and affect judgment, impulse control, and reward processing, which matters when someone is making health policy for millions. Here's what the science shows in short. Chronic heroin opioid use is associated with changes in the brain's reward system, reduced prefrontal cortex volume, and white matter integrity. Now, white matter is, the reason it's white is it's myelated neurons. And what myelation does is it causes these impulses to travel extremely quickly. So when the brain's communicating with other parts of the brain, that's where these myelated cells that we call white matter are being used. So let's see. So the prefrontal cortex volume and white matter integrity and alterations in stress and decision making circuits. Those changes are linked to research problems with impulsivity, planning, public health leaders to have intact. But, and this is important, some recovery of the brain structure function is possible with sustained treatment and abstinence. But I think we need to drug test somebody. So what's a responsible response? Don't conflate past addiction with incompetence or evil. That's stigma. But do insist on transparency, evidence, and accountability. Ask for documented policy rationales. Demand that public health guidance come from peer-reviewed science and expert panels, and press senators and reporters to scrutinize claims that could harm the public health. Vote with information. Cite credible sources when you push back, and vote and call out misinformation when it risks lives. If you're making a public post, keep it factual, note his public admission, summarize peer-reviewed evidence about long-term opioid effects, and when focus on the concrete policy issues you disagree with, vaccines, harm reduction, or anything else, and show the science that contradicts them. That way you win the arguments with facts, not smear. I can summarize RFK's public remarks about his addiction reporting in the AP. I think just through history of a long-term addiction to heroin, he should have been tested and should be tested randomly for what a drug test. I mean, I've worked with long-term addiction, and it's extremely difficult to ever kick, especially after years and years of use. And he's admitted it. The NIDA summary of long-term heroin effects, white matter decision making. These are just some of the sources if you want to look them up. Review neuroimaging literature on white matter and frontal changes in heroin users. Remember that prefrontal cortex is a major part of your brain making decisions. There's a recent study on white matter recovering during treatment. Criticism of RFK's anti-vaccine claims, example reporting. So, practical ways to push back, which we should be doing. Demand evidence, ask for citations, peer-reviewed studies. When he and his allies make scientific claims, share fact-checked threads, post short rebuttals, and link reputable sources, CDC, peer-reviewed papers, and IDA. Contact decision makers, email your congressional offices asking them to insist the HHS decisions be evidence-based and transparent. Support professional journalism. Tip reporters to follow the money, conflicts of interest, and science. Promote harm reduction and treatment. If you criticize, pair it with support for evidence-based addiction and treatment and public health. This keeps criticism to a constructive and avoids stigma. So, these ideas that JFK Jr. is coming up with and these policies he wants to make are not science-based. I think we should demand his peer-reviewed evidence. I want to see the science and the vaccine. I mean, there's just so much that doesn't add up. And he's making claims like you know, what vaccines do and what other drugs do. And he has an obsession with autism and has no idea how autism works or how a vaccine could even get the immune system in the brain. He doesn't understand that. I mean, so much he doesn't understand. He doesn't understand the mental health drugs, and here he is, a drug addict, and I don't know if he tests positive or not, but you're always an addict, and I've seen very few people be able to get off heroin and other drugs after years of use. So I would love to give our Health and Human Secretary, who says he's making America healthy again, just take a random drug test. And that's just my request. I think that's reasonable. And now he's saying that med schools don't get taught to get the root cause of the problems, which is completely false. And again, he makes these statements that he has no idea what he's saying. He has no idea what they're teaching in medical school. And this is our HHS secretary. I mean, come on, we've got to do something about this, because he's destroyed our CDC, and our health in America is going to suffer. I promise you.